Hi everyone, this is Amy with 100 Plus Abandoned Dogs of Everglades, Florida. Wanted to make sure that hey everyone, this is Amy. Sorry about that. I am at BluePearl again. One of our little rescues that we pulled from the Broward Kill Shelter. Can you hear me okay? One of the rescues that we pulled from the Broward Kill Shelter, Charley, little Charley, that we rescued. He was an owner surrender. He's approximately 5 years of age. He's been in foster with Maria and her wonderful family. He's such a sweet, sweet, sweet dog, and they are beyond amazing as fosters. He's been coughing and coughing. We've seen 3 veterinarians now. Yesterday he was at Leader 24-hour Animal Hospital. They put him in oxygen. They gave him some steroids, I believe. They put him on hydrocodone. It's not working. None of it is working. He also saw our general practitioner, Dr. Kesha, at VCA Imperial. He had chest x-rays. It just doesn't stop. So I said, you know, she sent me a video this morning when I asked her for an update on how Charley was doing. And the video was him just coughing, coughing, coughing. And she said if he's calm, he's quiet, but as soon as he gets up and starts moving around, he is coughing nonstop. And I have my mask on. I'm in my car by myself. But I can't stand seeing him like this, so I decided, you know what, just meet me at BluePearl. I spoke with the specialist, Dr. Trout. She's here. Dr. Worley's here. I just want to have him seen and make sure we're not missing anything. So I don't think the medication that he is on is working. I don't think it's the proper medication. He may need something else added. The reason I decided to go live, I was just planning on meeting her here, and the reason I decided to go live is I'm like, why not? I mean, I bring you along for everything, so why not see what I have to deal with on the back end? Every minute there's another emergency. He's such a sweet boy, and I just want to get him to where he's feeling better. There's nothing, it's not kennel cough, no, it's trachea. And you know, that he was on Baytril, a whole cycle of antibiotics with Baytril. He was on other medications. I asked her to bring all the medications with her so that we could go through it with the doctor. The challenging thing is that we can't go inside the hospital. We have to wait outside in our cars. So basically it's hand the dog over and then they do what they need to do and we stay in our car. So I'm waiting for Maria to get here, and then we'll go from there, and I'll let the doctors know that we're here. But I wanted to bring you all along with me to see everything that's happening. It's just constant. It's just constant. These poor babies, you know, and this is another thing. You pull a adorable, healthy little dog, middle-aged, 5 years of age, from the shelter, and you know, you think, we're going to get him out of here, we're going to get him in foster, where he's neutered already, he's vaccinated, and we'll find him his forever loving home. Well, obviously it doesn't work like that. I can't tell you, the majority of the dogs that we rescue, whether they're from the shelter or on the street, we can't get away with just taking the dog for an exam and then finding it a home. We have to go through doctors, emergency hospitals. There's always some major medical going on with these little babies. And I'm just reading through the comments. So just waiting for Maria. We're meeting at 1, and I hope she can find it okay. It's a little tricky to get to. But as soon as she gets here, then I will let the doctors know that we're here, and they will come out and they will grab him from us and take him back, and then, diagnose him and see exactly what's going on. No, that's a different Maria. This is actually a new foster. She's phenomenal. I love her and her family. They're so wonderful and nurturing, and they're on. He had x-rays. Yes, they did x-rays. His lungs were clear. They had him on everything. Everything. It's just really, really frustrating for the poor little guy that can't breathe. And I just got a call from the same hospital that I'm sitting outside telling me that my ashes are in for little Sassy, the Yorkie that we tried to rescue with the collapsed trachea that we had to humanely euthanize. So we have to pick up ashes. So I'm just sitting and waiting for the foster so we can get him in. Tiffany updated. You might have missed the video. You're talking about Puppy Lazarus, aka Deuce. Tiffany updated a video from home with the puppy and gave you a full update on his diagnosis. We still don't know what is going on with him. They're still waiting some testing results to come back, which could be within a week, under 2 weeks they said. But it depends on how back up the labs are with all of this pandemic going on. Everything is just put on hold. I just ran into 2 pet stores to try to find puppy wet food for Puppy Lazarus because we're out. And I tried ordering on Amazon. I tried ordering on Chewy. None. There's no Nutro puppy chicken loaf pate. So I went to 2 pet stores. I had to literally wait at the front in between a taped area, tell them what I want. They go and get me the food, and then they come back with what I need. So they gave me 9 cans of food. That's all they had. I have to try to hunt down puppy food now. You guys, you're throwing way too much at me right now. Charlie's a little white chihuahua. You guys are just, I'm reading the comments. Please understand when I'm talking about, when I'm on a video and I am talking about a dog and you're throwing at me every dog, how's this one, how's that one? Guys, we update every dog on our page. So please take the time, just as we take the time to update you and do all our live videos. Go back. If you don't get a notification, go back on our page, scroll through. It's just a day's worth or 2, and all of our live videos are there for you to see on every dog you're asking for an update. And thank you, because it's just way too much for me to answer all these questions. Yeah, it's a lot. So please, thank you, Erin Howard, for understanding. I'm waiting for them to pull up. I would show you the dog, but the dog is not here. Sorry, you have to look at my face for a few more minutes. I am sitting outside the 24-hour hospital. I jumped on maybe a little bit too quick, but I figured it would, overload. I jumped on a little, maybe too quick, so... Hold on, let me get my mask on. Sorry. I was doing a video. I'm still waiting on the dog. Is the dog here?
Oh, no.
No.
So I was here to check if the dog was here.
Not yet.
So do you know the name?
Dog's name is Charlie.
Charlie? Okay.
The little white chihuahua.
Okay.
And collapsed trachea. And he can't catch his breath.
Okay.
He's been at 3 different vets. And
he's passed away 3 times?
No. He's been at 3 different veterinarians.
Okay.
And nobody's given him the right dose of whatever to make him breathe.
Are there current x-rays?
Yep.
Okay. I'll let them know. Charlie?
Yes.
How old is he about?
5.
5? Thank you.
Thank you. So that was the nurse coming out to get the information on Charley, so that they'd be prepared. Thank you. You like looking at my face. Thank you. No one listens to me, Lauren. Nobody listens to me. Everybody just keeps talking. Trachea problem. Waiting for the foster to pull in so I can get the dog into the hospital. It's Charley. It's a dog we rescued from the Broward Kill Shelter along with Mimi, if you remember, and Tommy that day. Mimi got adopted, is doing fantastic. Tommy got adopted, is doing fantastic. And Charley's dealing with some trachea problems. And we're just trying to get him, on the right medications so that he can have a full life, because he's the sweetest thing. He's the most loving, easy, sweet dog. And it's just so unfair that he's having all these problems. So we're going to do everything in our power. You remember him? He's a white, adorable, maybe 8-9 pound Chihuahua. Is the exact name of the food Neutro Puppy? Yes, Robin, it's Neutro Puppy chicken loaf pate. Yes, they don't like the chunks. It's for Lazarus. Is that what she changed the name from Deuce? It's easier. They don't like the chunks. So thank you, Jody. I'm breathing. Appreciate that. Thank you. Yeah, so if anybody can find any chicken, we like chicken, but if it has to be lamb, pate or loaf by Neutro Puppy, desperately in need. I could only get 9 cans, and that's all we have. Tiffany has a few cans to last her until tomorrow, so I got 9 cans. And we're still waiting on test results. And that is not Charley. She's coming from Weston, so I got here a little bit early, and now she's just a few minutes late, but I'm sure she's on her way, probably having a hard time finding it. It's really kind of tricky. Just looking around me, wasting time. Here she goes, Chris. How baby Judah? Baby Judah's fine, thank you. While I'm sitting, I might as well talk about Judah, right? Baby Judah needs another week to build up more strength. So Shelly's going to be taking him home again with her starting tonight, feeding liver, and I ordered liquid iron for puppies, and the doctor highly recommended us get that for baby Judah to start him on. And yes, Neutro chicken, puppy, pate, or loaf. Please, that's what we need. It has to be puppy. Yes, my hair is naturally curly. Thank you, Becky. Gage and Godiva are doing phenomenal. Fantastic. So yes, we are putting off baby Judah's surgery for another week for him to build up more strength. So that was the doctor's recommendation. Still not here, I don't think. Hold on one second, guys. Okay, I'm just gonna walk around and see if she's maybe in the parking lot and parked somewhere else, so just bear with me. Oreo's having surgery Monday. It's all scheduled. The dog that we're helping out with the FHO surgery, I don't have a price on that surgery, but we are covering the surgery. take it off me for a minute. Flip it on the parking lot. So you don't have to look at me. I don't see her yet. It's really tricky for somebody that doesn't know where this hospital is. So the main road is all the way out there, past a Wendy's, which you have to turn down this street and come into this big parking lot here. It's a little confusing. Sometimes the navigation throws you off, so I'm assuming that's what might have happened. But it's hot out, so I'm gonna wait in the car. You're stuck with me until she gets here. I could shut down, but that's stupid. Why shut down? I'm just gonna stay waiting for her to get here. Hold on 1 second. I'm just gonna check my text messages to see if she's lost. Hold on, please. Nope, no text. No text. Why do they always have to be trimming bushes when I come here? You rather look at me? Okay, there you go. You rather look at me than the building? You got it. You asked for it, you got it. Come on, Maria. Little Charlie. So again, for any of you that are just jumping on, recap really quickly. This video is little Charlie. I'm waiting on little Charlie to show up at the 24-hour animal hospital. I am in Oakland Park at the BluePearl, aka LVS, and I am waiting on him to come here with his foster because it's CHARLEY. I'm waiting for her because he is having serious problems breathing with his trachea. He has had x-rays when we first brought him in. He has been put on antibiotics. He has been on several different medications. He yesterday was taken to Leader, which is in Cooper City, LEADR, and they put him in an oxygen. They gave him, I believe, a steroid shot. I had to suggest putting him on hydrocodone because that's what works for most dogs with trachea problems. It's almost like a suppressant. And I'm getting text messages. I don't know what that was. I have to check that. But
new text message from +19542904561.
Anyway, so yesterday he was at the 24-hour hospital. She rushed him in because he couldn't breathe well. And after they calmed him down and he was doing fantastic, he was breathing well, he was, you know, a little sedated. I checked in on him throughout the later afternoon and she said he was resting comfortably and they were going to start him on the hydrocodone as a regular medication. They wanted to keep him overnight and I absolutely said no. He was stable, he was breathing. They wanted $1,200 for one night to keep him in a cage to monitor him. I'm like, absolutely not. Number one, that's going to stress him out. And I would rather him be back with the foster and they can rush him anywhere he needs to be to a 24-hour hospital. I gave her the address, gave her everything as to if God forbid there was an emergency, where to take him. So he was fine last night, and then this morning she updated me with a video, which unfortunately I can't show you while I'm on the phone with you. So it's, you know, him having a very hard time. He's walking around and he's excited and tail wagging, but he can't breathe. And then when he lays down and he calms down, he can breathe well. So it's usually when he gets excited, if they walk into a room and they start talking to him and he gets excited, that's when he has a hard time breathing. But that's not a normal way for an animal to live. So, you know, you don't want to keep an animal sedated all the time. So yeah, we go from one doctor to the next, not to mention the vet bill on top of vet bill on top of vet bill. I declined last night for the $1,200. It's not common in dogs, but it's common. The more the more I look around, the more I hear that more dogs have trachea problems. It's very common in Yorkies, the Yorkie breed. For some reason, their tracheas, they always have problems with their tracheas. So anyway, still waiting, 112, for Maria and Charlie to show up. I haven't heard from her, so I'm assuming she's on her way, just running a little bit late. I know, there's nothing, Barbara Byron. I was looking online, I could not find any Neutro puppy pate or loaf. That's what we need for. Can't find any Neutro loaf. I know. And yes, all of you. You know, I had a supporter call me last night, Marcia, and she had paid our rescue house a visit. And she said, you know, Amy, she said, I can't adopt, and I loved visiting with you and your rescue. You're amazing. But I want to donate and I want to make a difference. And she said, I set up for a monthly donation. And she called to tell me she wanted to donate $100. She said, if every one of your supporters just set up a monthly donation, even if it's for $2, $5, it adds up so quick. I said, could you imagine with over 240,000 supporters, if everybody signed up for a monthly donation, that it's just automatic, whether it's even $1 or $2, you know, I would never have to ask for donations. I could just keep doing what we're doing and just focus on rescuing. No, I'm not doing the chunky and putting it in a blender. I'll find it, but thank you. I guess if I get desperate, that's what I'll have to do. Okay, I think this might be her. I think it's her, so. Okay. Bear with me, guys, okay? I'm gonna flip it. I think she just pulled in. I hope it's her. Just bear with me, guys. Sorry, you're looking at the poop bag in the garbage. Hi, Maria. Oh, even Daddy came too?
Yeah.
Oh my God. Are you kidding? You're all here? Charlie, what's going on, baby? Hi, boo-boos. I love this boy. They just came out, so I'm going to tell them you're here. Just bear with me, and then we'll get them in. Nice to meet you under the circle. Nice to see you. They're such a wonderful family, all three. Oh, and the mama. Remember Charlie now? Maria? This is so weird where you can't go in anywhere, you know?
Right, but the doctor comes out, or it's like the assistant?
Doctor.
The nurse? Okay.
Hopefully. Or maybe the assistant. And then the doctor comes out and talks to us. Hi, my little baby. My little face. Look at this face. I've got you on video. There's only, what, 605 people looking at you.
Hi, everybody.
This is my angel foster family right here. For my little Charlie. Isn't he such a good boy?
So good. No,
So
we
good,
love
right?
Him.
I just got to get him to breathe. It's awful. It's so frustrating.
Yeah, the hydrocodone wasn't being like effective. Here's the one that was like in liquid. This is what they gave me.
Okay.
At the
and this is the
at
pills.
the emergency. That's the pills. But he's getting really bad side effect of sedation.
That's what it does.
Yeah.
So it's a calming. And they're gonna sleep.
Right, but we noticed then that's why he doesn't cough because he's sleeping.
Right.
But it isn't actually, going to the root of the.
This is what they use. But I want to see if there's something. My dog sleeps all the time.
Oh.
But my dog's like 15, 16, and
Right.
blind. So it's a matter of not all the time, but most of the time, my dog sleeps. Come on, it's so hot.
He has that trachea thing from the X-ray.
Yeah.
To see.
Yeah.
If that all relates.
Howdy, we're back again.
Hello.
This is Charlie.
How you doing?
Um,
Charlie here.
So he's been on hydrocodone.
Okay.
We have liquid, we have tablets,
Okay.
but he's also been on other things.
Yeah.
Okay. So is he? How is he with the
Trachea.
medications? Yeah.
Sleepy,
Okay.
but it's not working. It's not, he's still coughing.
He's still
Right.
coughing?
Once the effect wears off, actually the cough has worsened.
It's getting,
Okay.
yeah.
And
worsened.
2 days ago, he got a sudden attack that it looked like a seizure, but it lasted for about 15, 20 minutes. The time it took us to get him to the hospital. In the car, he was struggling to breathe, and he was paralyzed. So it looked like a seizure, but it
Okay.
lasted a
It was
long time.
like a coughing attack. Would you like?
The doctor actually, it was Leader, Leadr.
Okay.
This was yesterday.
Yeah.
This
no,
was it yesterday or the day before?
The day before yesterday.
Day
so-
before?
Yeah.
2 days ago.
Yeah.
Okay.
Yeah.
We assume that maybe it could have been like some sort of allergy reaction, maybe because for a seizure, we think it would have been like a small period, like maybe 2 minutes or something.
What was the
but
other
this-
medication that the other doctor put on?
So
Do you remember?
yeah.
What was it? Do you
so
remember?
another doctor gave us an antibiotic that was Baytril,
Okay.
and that helped him. He was cured. He was great on the Baytril, and he lasted
Okay.
fine a few days after the treatment ended. It was a week.
Okay.
But there was
with
something
Baytril
else he put him on.
And an antihistaminic, but was Atrax. Atarax.
Okay.
An
Like
antihistamine.
an antihistamine.
Yes.
Yeah.
Okay.
And with that treatment, he was totally fine. The treatment ended after a week.
Okay.
And we were also nebulizing him with Baytril,
Okay.
and the saline.
Yeah.
Whoever thought fostering would be.
So would you say the coughing, like, is this getting worse? Is it the same? Like, when do you notice what brings about the?
Well, I
Excitement,
think that-
anything, moving.
Yeah, he gets agitated, excited, but the coughing has gotten more intense. Like before so when he was on the Baytril, he was perfect, no coughing whatsoever. He was moving around, his good behavior, like
Okay.
good mood.
Okay.
He was totally perfect with it. When we got off of it, about 3 days later without it, we noticed a little coughing. But we were like, oh, no, maybe it's
Okay.
a little thing, it's fine.
Okay.
And then he got the attack 2 days ago.
Okay.
That we don't know what triggered it exactly. We even assumed
Can we
that
just
he
back
could have
to the right?
that he could have been maybe like before the attack. He had been chewing on his bed,
Okay.
and he has even like ripped it open a little bit, so it's inside. It's like polyester. So we even thought, oh, maybe he got like an allergic reaction, maybe.
Okay.
But we changed his bed. We took him out but he still this morning he was having a lot of coughing fits.
So this morning it was okay. So like that.
Yeah,
Okay.
we have some videos from this morning.
I sent the video to Dr. Trout.
Okay. Does he ever have episodes where he turns like blue or like cyanotic, meaning
No.
like that he's never gotten to that point where he's just pretty much just like this. Okay.
Right, but more right now he's just like panting,
Yeah,
but
'cause it's
he has more
noticeable.
coughing. He's also sometimes he gets like teary eyed. You know
Okay.
that it feels like
Okay.
or-
So the initial response, the initial attack
Trachea.
was like two days ago. You were saying?
No, he's been coughing
He's
for.
been coughing since we.
Yeah, it's been
received him,
weeks.
since we
It's been
rescued
weeks.
him from the
Okay.
shelter.
We've been trying to find a remedy for this
Okay.
dog for weeks.
Yeah, and then 2 days ago was this
How long have you
attack
had
that
him?
we can't-
Now-
Since March 19th.
Was
So almost a month.
Almost a month.
X-rays ever taken?
X-rays were clear.
Okay.
Yeah.
All right.
He's hot. Can we get him inside?
Yeah, we get him inside
Okay.
now. Okay. So when was he given the hydrocodone and the Vicodin? Like when did you guys give that?
So
This
2 days ago we were given it in tablet form, and but this morning I didn't
Nothing.
give it
He
to him
didn't get
because I want you
anything
to
this
see him,
Okay,
without having the
absolutely.
sedation
Okay.
effect. And when we took him to the doctor, with Shayla, what's her name? I forgot the.
But that's
Oh,
okay.
Kesha.
That they gave us in liquid form.
Right.
Okay.
But we
You didn't have it started.
see
Okay.
Yeah.
Okay. I just wanted to know when you were if he got it today.
Did he get any medication today?
No.
No,
Okay.
ma'am. Okay. So
And he had an attack today.
He had the coughing fit in the morning, but we noticed the cough was worse than before.
worse. Okay.
Because he needs to be on these.
But before it didn't sound so bad, the
Without them.
coughing. Right.
Okay.
Let's see what they think in
Yeah,
there.
definitely.
Do you
So
want
let
us
me
to
see
take
the-
that
yeah, I'll
back
take
with you and then
these.
just bring them with you?
Absolutely.
Yeah. So he had last night. That one, yeah.
Okay,
In
a quarter.
1/4, yeah.
What time? Do you remember? Like, is it
Like
late?
8 p.m.
8 p.m. Okay,
Yeah.
and nothing since.
Mm-hmm.
Okay. So
Did
yeah.
he eat breakfast this
Yeah.
morning?
And
Okay.
he's eating and drinking fine.
Eating, drinking fine otherwise. Okay. All right. So yeah. So I'll just take him to the doctor and we'll get his vitals and
Do you
then.
need the leash and the harness?
Yeah, just take the whole thing.
Take the whole thing. Okay. But for now,
Oh, maybe you don't, right?
maybe no. Harnesses are good. So but I'll keep the harness. I don't think we're gonna want to see him walk or anything. But actually, I'll just have you.
Why don't you put it on? Let's put it on here.
Let's put it on here.
Well, actually, when we do the exam, I think it might just be better.
All right, so why don't we just hold everything
Yeah,
here?
we'll hold everything. Okay.
Okay.
And I'll just get him in there. Okay.
Okay, thank you.
Absolutely. Okay, Charlie.
Poor Charlie.
Yeah. Because we didn't like the sound of his cough, and what worries me about the hydrophone is that it's like sedating him.
But that's what it's. If there's no medication that's going to fix, you can't fix a trachea. It only gets worse as time goes on. I've learned this, sadly.
Right.
It's a horrible
so he'll
thing.
be like dependent on the.
He is going to be dependent on a medication for the rest of his life. Unfortunately, we just have to find which medication.
one? Yeah, because that first.
The majority of the medications, they will sedate because that calms the trachea. Even though they're going to sleep, if that's what it's going to take to allow him to breathe and just be a chill dog, that's what it's going to have, unfortunately. Do you know what I mean?
Be able to.
I know you don't want to see, I hate seeing my dog at home sleeping so much, but if I skip, like I'll be like, you know what, I'm not going to give him the pill. I'm going to, because they want me to do a half a pill of hydro in the morning, a quarter in the afternoon, and a half at night.
Wow.
3 times a day. And I'm like, that's so much, you know? So I'll skip it. Sure enough, attack, coughing. He's pacing, he's circling, it just makes him crazy. So I'm like, okay, that's it. This isn't about me. He's gonna sleep, but it's gonna keep him calm, you know, and I let him outside and I let him walk around and I let him do his business. I hold him, I rub him, I kiss him. Mine's blind. He's a lot different than Charlie. Mine's like 15 to 18 years old.
He's a small dog.
He's about probably 18 pounds. He's small and fat. He's like a big, I don't know what he is. But Charlie is 5 to 6. He's a young dog,
because,
you know?
with the Baytril, we didn't have any side effects like that. So
But
maybe they
Baytril
can
is an
find
antibiotic.
something.
All Baytril is an antibiotic.
Okay.
So Baytril, first of all, you can't have your dog kept on an antibiotic. It's a cycle. You can't keep a dog on an antibiotic.
Right, because they get immune to it.
It does,
after
yeah,
some
you
time,
can't.
diversify.
Right. And that's not something that is, but remember, with the Baytril, the doctor prescribed that antihistamine.
Yes.
So the antihistamine
Relax.
is probably what was calming the coughing. The Baytril was, killing any bacteria or any infection or anything
Like
that he had.
inflammation.
Right. But the antihistamine is what I think, which was calming the
Before,
coughing.
something that he hasn't done again that I think was cured was he would try to scratch his throat by making like a coughing noise. But it wasn't coughing like this morning, like the video.
Do you have the video on your phone? I want
Yeah.
people to see it because I can't show it
Oh,
while...
I left my phone in the car.
Oh, it's
Let me
okay.
go.
Sure. The little video, I want to show the little video. How are you guys holding up?
We're doing good.
You doing okay?
Yeah.
Yeah? With being locked down? Just kind of keeping busy?
Charlie keeps us company.
Right? And your mom's doing okay?
Yeah.
Yeah.
What else we can do, huh?
There's nothing we can do. There's nothing. We have to stay safe. The world is shut down. I'll tell you the truth, even if it goes back to normal and they open up, I'm not comfortable. Like, I don't know when I'm going to feel comfortable going and sitting in a restaurant and no way. Or going to a mall, no way. Forget movie theater or anything like that, or concert. What did she say? She can't find her phone. But thank you guys so much for just taking such amazing, amazing care. I saw he was in your lap, Daddy.
He's one of us.
He what?
He's now one of the family.
One of the family.
Yeah.
He's a sweet baby. You lose your phone? Uh-oh. Maybe it fell in the... You gotta find your phone, though. So cute. So guys, we're at the, you got it? Oh, good. Oh, is that the belly rub?
Yeah.
Definitely.
When you walk around him, he goes and gives the belly.
Yeah, that's terrible. And he still wants a belly rub, the sweet baby. You can hear it, guys, on the video. It's constant coughing. Yeah, he can't live like that. Thank you for sharing that with me. He can't live like that. Otto was coughing more, and we took to our vet. Hold on a second, guys. But one of my adopters, Judy. Hi, Judy. I just got your message. She adopted a Yorkie mix from me. We were just saying, right? His name is Otto. You guys are watching. You remember Otto that we pulled from the Miami-Dade Kill Shelter, and the coughing. Well, she took him to her vet, and she's had him for quite some time now, and they put him on prednisone. And it seems to have cut all the coughing. It's a steroid, but they can do little bits, little doses, you know, of prednisone. That's probably what we're gonna have to do. That's what they do initially if a dog's in an attack. I think that's what they did at Leader. They give him a prednisone. They give him a steroid shot.
No, they said they gave him Valium.
Oh, Valium. No, that's not gonna do, no. Valium. That was the doctor. She's coming out. She didn't know I was out here. So guys, Dr. Woolery is gonna come out. She's like one of my favorite doctors. She's gonna come out and kind of give us an update. You'll love her. She's really awesome. I know I froze because I'm checking my messages. One of our adopters who has Otto, Judy, hi Judy, who's doing fantastic. He was on so much medication and now he's like on nothing and no coughing. So this is what I want to do for Charlie. I want to get there for Charlie. What do we have?
So what's the story?
Trachea.
Well, I know, but what, give me some, I didn't
Okay, here we go. Again.
Okay.
Start at the beginning.
Sure. So we rescued him from Amy.
They're
almost a
fostering.
month
Okay.
ago, and he's always been coughing. So about 10 days later, he's really like in his behavior. He wasn't moving, coughing more and more. So we called a different vet that got him on Baytril and Atarax as an anti-saline, and also we were nebulizing him with a saline solution and the Baytril, nebulizing him daily, and that got him really well. No coughing.
This was a month ago?
No,
No,
this was
couple
about
weeks.
2 weeks ago.
Okay.
And then he got off the treatment. That treatment lasted about a week, and he was fine without anything for 3 days. And then we started noticing over the weekend, like he's coughing a little bit again. And then 2 days ago, he got a sudden attack that he could not breathe. So he was paralyzed, like choking for air, and we drove him to the
Leader.
Okay.
hospital.
They gave him Valium
Okay.
and
And they prescribed us
hydrocodone.
You know, they couldn't really tell what it was. They thought it looked like a seizure. But the thing is that it was a 20-minute long fit as we were driving in the car and holding him, and he's struggling to breathe.
Okay.
We even assumed it could have been like an allergic reaction to maybe his bed, you know. So
He
we
was chewing his bed.
before he got shot.
The polyester inside. And after that, he got the episode.
It started with coughing?
No, he paralyzed.
Okay. Literally, he was
And
chewing.
started making a noise that he
Allergic
couldn't.
reaction to polyester or something.
And,
So
And-
we don't know the root of his coughing, and we don't know the root of that episode.
and prior, before she, you know, we had him at our vet at IP, Dr. Kesha.
Okay.
They did x-rays.
Got it.
They had him on
Doxy, yeah.
doxycycline,
This was all within the last
month.
Month. Yeah, but we had him while we were finishing the doxy, and we
Yeah.
didn't notice
No
an
difference.
effect
Sure.
with the doxy.
But we need to find something, maybe a
Yeah, so
prednisone or
He's
something.
probably going to need a lower airway workup, which isn't going to happen through the emergency room today. So what that would include would be a consult with internal medicine, and then what they can do is they can talk about getting a sample of what's growing down in his lower lungs. Oftentimes it's a tracheal problem, so collapsing trachea, but they also have chronic inflammation down in their lower airways, which does respond to steroid, antibiotics, etc. So you're telling me he responded to the antibiotic,
Yes.
so there's likely an infectious component to it.
Right.
But for now, the dose that he was sent on the hydrocodone, we can go up on that. So yeah, we can almost even double it, which is great.
But he has a lot of sedation.
All he
like,
does is
inside.
sleep. I told her.
I know, it sucks because we have to find the right balance between what's the lowest effective dose of the cough suppressant plus steroids plus antibiotics. You don't want to keep him on steroids long term because that's detrimental. So it's this balancing act of finding how low can we keep him on these medications. When I listen to him, I can hear definite increase in his respiratory sounds. So I'd be interested to see what the X-rays look like, from lead or wherever.
We have
he
the
has it.
X-rays.
We have them.
Okay, we'll get them to input it into our system, and I'll take a look.
Okay.
Do you guys want to take some fresh x-rays to see?
I don't think it's going to change what
A
we
month?
do right now. Yeah, because he's going to need a workup for the lower airway stuff.
What is that? Sedation and go in his
So
throat?
sometimes, it's called a bronchoalveolar lavage, and Dr. Cannon would be the one to talk to you about this and recommend it. We may just try medical management first before we do that procedure. But it's a quick procedure. You put a couple of cc's of saline down in the lungs, and you get a sample and you send it out to the lab and see what they can grow. But there's a lot of other things we can try before we do that, but it really should be done by internal medicine, not through the ER.
Okay.
Okay. Sorry.
What can you suggest him? What would you put him on to
I'm
come?
going to do a low-dose steroid, short steroid taper. So we'll start that today, increase the hydrocodone, and I'm not going to put him back on an antibiotic until he has the workup.
Okay.
I want to make sure we choose the right antibiotic, because what happens, sometimes you can treat them with antibiotics and kill some of the bacteria, the
Right.
good bacteria, and it can allow other bad ones to grow, and you can create a really bad problem if you do that. So he's seen 2 antibiotics in a month.
And it didn't.
Yeah, so I'm going to
Yeah.
take a break from that and try just the anti-inflammatories and the cough suppressant.
Okay.
But what I want to caution you, just so you're aware, collapsing trachea dogs cough. They're going to continue to cough. He's never going to not cough.
Okay.
So that's it is a chronic progressive degeneration of the cartilage in the windpipe. So I have a Pomeranian, she has collapsing trachea, so we can go, she coughs every day. She coughs in the morning when she wakes up, she coughs at night. We give the hydrocodone, and we, I've got a low dose for her. Where
Me
she still
too.
feels
3
like
times a
that.
day for
Yeah.
my dog.
Yeah.
Sleeps all the
Yeah.
time, but you know
Yeah,
what?
But you got to do it, because every time they cough, it makes this weaker in their throat, right?
Oh, right.
And then seasonally, it gets worse as
Yeah,
well. So
allergies.
with humidity is bad for it. Florida's bad for
Yeah.
it. It's like the perfect, like really he should be in Colorado with clean air, not any humidity. But we live here and there's lots of allergies.
So only outside to do business and keep him
Yeah,
inside.
keep them
Okay.
inside in the AC.
No walks. Not even any walks.
Yeah,
Okay.
I wouldn't even nebulize him, because sometimes that humidity can be irritating down there
Oh,
as well.
right.
So yeah, I mean, there's options that we can try. I don't know, I haven't looked at the images, I don't know how bad it is. I don't know if he has bronchial collapse, but there is, you can place a stent in
They just did lung x-rays. They didn't do...
the neck. Yeah. So that'll need to be done.
Okay. Okay.
We'll try this.
Do I need to
here.
make an appointment with Cannon?
Yep, I would,
Okay.
and I would get it while you can, because she has some openings
I know.
now. which
I
is-
want to get in as soon as possible.
Yeah.
Can you look and let me know when
Yeah,
she's
I'll have
available?
Sandy come out.
Okay,
and get
great.
scheduled for internal medicine, and then so she'll do the workup and talk about what do we need to do. But from
I
the
texted her this
services,
morning. She didn't answer.
She's
up-
busy.
Okay,
She's
cool.
busy today.
Okay.
But through the ER, we're just going to try the steroid taper and the and increasing the dose of the hydrogen.
Okay.
Sound good?
Perfect.
Any other systemic conditions I need to know about?
Perfect. He's
Thyroid
perfect.
Issue, kidneys,
Nope.
nothing else. Just the lower.
Yep.
Okey-doke.
Thank
Come
you.
and get it.
Thank you.
All right, bye.
This is exactly what I knew.
Okay.
They're going to do a tapered steroid, so they're going to start you on a certain milligram and work your way down to lessen it, so it's not a forever. What you have, as much as you don't want to, whatever she tells you for the amount of medication, give it to him. Don't skip. Believe me, I get what you're doing. I did the same thing. Don't skip. If he's sleeping, let him sleep.
Okay.
You have
Right,
to
it's part
give.
of the
Yes. I'm going to get an appointment with Cannon. We're going to do the test. We're going to figure out. There's nobody like Cannon.
Okay.
She's an internist. She's a specialist. Nobody thinks she thinks outside the box out of every doctor. I'm telling you, when people have told me I go to 5 different vets like I'm doing with you, put the dog down. Put the dog to sleep. Come to Cannon. The dog's still alive 3 years later. So we're going to make the appointment. We're going to get in with her and let her do her magic. But for now, let's get him comfortable. Let's get him on the prednisone. Whatever they suggest for the hydro, the amount, write it down and give it to exact to a T.
Perfect.
Okay?
Yes.
Okay, Daddy? We'll get him the best, the best. So guys, there you have it. Thank you so much. I just wanted you to see, this is what we deal with on a day. I know, right? This is what we deal with on a daily basis. So we're going to get Charlie taken care of. We're going to make him feel better. We're going to, listen, we're doing everything we can. Every day, running from one doctor, why didn't offer to check Sassy to see if they need a stint in her trachea? What? Sassy was way too far gone. There was no saving Sassy. I need an appointment.
Yeah, I don't have anything till April 30th.
April 30th?
Like 2 weeks.
2 weeks.
On a Thursday.
Okay, can you tell?
Anything cancels.
Can you tell her if anything cancels, I will be here.
Yes.
Anything cancels, please.
And things are canceling.
Good. What time?
So,
What time? April 30th?
let me look. I think it's 9.
Okay.
Okay.
Hopefully, so the cancellation will get in sooner. So, what was I saying? Sassy. Yes, Sassy. There was no saving. She was too far gone. 9 o'clock.
9 or 10:30.
9 or 10:30.
10:30.
10:30 is better.
Then I'll call you and
10:30 on the 30th of April. Thank you. 10:30. I'll text it to you if you want me to. So guys, I'm going to shut down. We'll keep you posted every step of the way. Marie and her family will send me updates and I'll update all of you. But for now, Charlie is in the best hands. We're doing everything we can. I'll see you later on tonight. 100 plus abandoned dogs of Everglades, Florida.